Well, good morning, everyone. As Mike said, my name is Ann Robinson, and I work at the GRC, and the GRC provides administrative support for this project. So that's how we're involved. And all of the work presented today is the result of a collaborative effort from Emily Bailey, Faye Young, Kara Whalen Smith, and myself at GRC, in addition to our partners at Neomed. I also want to acknowledge everyone here who has responded to surveys throughout the year that contribute to this work and helps us better understand and respond to the needs of the learning community. So thank you. I'm pleased to be here today sharing the results of the latest project evaluation and online toolkit updates, and we'll start with evaluation results. The goal of the evaluation was to understand the impact of the MSY ECHO during state fiscal year 2022, referred to here as SFY 22. This was during the months of July 2021 through June 2022. And one thing to note is that the project name change to reflect Person First Language is implemented on July 1 of this year. So the previous project name of MSY ECHO was used for the evaluation, and that's what I will use in this presentation. Here I'm sharing acknowledgement of project sponsors and partners, and that the views expressed in this presentation are solely those of the authors and do not represent the views of the state of Ohio or federal Medicaid programs. We had a total of 43 sessions in SFY 22 with a total of 2,177 participants and 507 unique participants. There was an average of 50 participants per session. And this Ohio County map shows where in Ohio participants came from in SFY 22. The map reflects attendance from 68 counties around the state. The darker green represents larger numbers of session attendance from that county. And overall, 79% of participants attended between 1 and 5 sessions. This chart shows that participants primarily identified themselves as being affiliated with developmental disabilities, behavioral health, or FCFC wraparound systems of care. The didactic presentation portions of sessions are recorded and uploaded to YouTube for public view, as many of you may know. This list represents 10 presentations that received the most views over the course of the year and give us an idea of public interest in particular topics, keeping in mind that some of the videos have been available for much less time than others, depending on the session date. We see that presentations on Ohio Rise core services and provider wellness and resiliency received the most interest. Now I will share results from the post-session survey that is distributed after each session. From July 2021 through May 2022, 470 post-session survey responses were received, and this was a response rate of 26.5. Survey respondents reported very high ratings for the MSY ECHO sessions overall and across systems of care. The vast majority of survey respondents reported that they strongly agree that the following were valuable to their work: the recommendations, case discussions, new ideas, supports or treatment approaches, didactic presentations, and case presentations. 88% of survey respondents reported that they will apply something they learned during the session to their professional practice. These results not only show a high level of satisfaction with the ECHO learning experience, but also an intent to apply new ideas and knowledge post-session attendance. A total of 41 cases were presented in SFY 22 by professionals from 26 counties. Note that there were fewer cases in sessions due to scheduled sessions with previous case presenters giving updates to the learning community and also GRC updates. This Ohio County map shows where case presentations came from in SFY 22 with DD quadrants outlined in dark gray. The darker orange counties had a higher number of teams, and we see that they were primarily from the northeast and southeast quadrants of the state. This figure shows system involvement demographics for cases. There were 41 cases presented on children 7 to 20 years old with 1 to 10 diagnoses per case. Diagnoses were most often from the categories of behavioral health and intellectual and developmental disabilities. And most often, cases involve behavioral, mental health and addiction, education, and FCFC systems of care. The key themes of priority questions from the case presenters included recommendations for evaluation, assessment, monitoring, treatment, and medication options, services and sources for the youth, and supports and resources for the family. Now I will share results from the case presenter survey that was distributed 2 months after each session. From July 2021 through May 2022, 14 case presenter survey responses were received, representing 11 unique cases. And so this was a response rate of 34.1%. This map shows where case presenters came from around the state, and the black stars mark the counties represented, again, primarily from Northeast and Southeast quadrants of the state. 100% of case presenters reported that presenting their case to the ECHO network was beneficial, and around 93% reported using recommendations provided by the ECHO. However, a majority of those who responded did report encountering barriers. Comments from responded primarily attributed barriers to a lack of access to services or resources in their area. The most highly beneficial aspects of presenting a case were the specific recommendations received, the availability of experts, the general discussion and processing, and the resources and links provided afterward. Next, I will share results of the annual survey that was distributed throughout June of 2022, the third and final. Out of a possible 507 unique participants, we received 83 responses, which was a 16.4% response rate. Responses came from 68 counties and were fairly evenly distributed throughout the state. Across half of respondents attended 5 or more sessions over the course of the year, and nearly half were in their first 5 years of their current professional affiliation. 89% of respondents were affiliated with developmental disabilities, FCFC wraparound, and behavioral health systems of care. And over half of the participants who responded to the annual survey had SSA, FCFC, or administrative professional affiliations. Most respondents reported that they felt comfortable asking a question or providing a recommendation during the sessions, as shown in the figure. Some who answered no to this question reported that they did not feel they had the experience or qualifications yet to be comfortable speaking up, or that they were not familiar with many services due to a lack of available resources in their county. 40% reported ever asking a question during the session, and 25% reported making a recommendation. The majority of survey respondents have applied lessons learned from the SoC ECHO for MSY to other complex cases in their practice, as reported through the annual survey. The majority of survey respondents felt the participation in the MSY ECHO sessions helped them to plan or make changes in their practice related to educational support, self-management, patient education, clinical procedures, treatment, screening process, diagnostics, and resources, as shown in dark blue. 30% of the annual survey respondents presented a case in the past year. Of those survey respondents who presented cases, 88% used recommendations provided by the MSY ECHO team. The 3 respondents who indicated that they had not used any of the recommendations reported that they either did not have the resources to implement services, or the youth was no longer able to utilize the services due to a change in custody. All of those who responded reported that recommendations were either very effective, moderately effective, or slightly effective in assisting their case. Key takeaways from the annual survey were that a majority of respondents reported that ECHO increased knowledge and skills for assisting youth and their families. A large majority of respondents felt empowered to ask a question or provide a recommendation. And most also felt that that participation in the MSY ECHO sessions helped them to plan or make changes in practice. We also heard from respondents that they were directly applying knowledge from the MSY ECHO sessions to complex cases in their practice and increasing their ability to serve multi-system youth. Survey participants felt that the ECHO enhanced their network of connections, and qualitative responses reflected the value of this. A few selected responses reported that the multidisciplinary approach has helped me build capacity to serve the whole child, and it was a really informative experience to see how the professionals looked at a family and identified areas of concern and strength. Based on these results, the following conclusions were made. We saw increases in the average number of sessions attended, geographic spread, and the proportion of participants providing care to Medicaid beneficiaries in SFY22. The survey results across all of the SFY22 surveys report positive increases in learning and changes in clinical practice, high satisfaction with the elements of the ECHO project process, and recommendations received. A high proportion of early career annual survey respondents indicate that the project is reaching a key audience of professionals who are learning or newer to their roles. And we did identify some opportunities, which were expanding attendance, providing additional resources for case presenters, and adjusting the timing of the case presenter survey to give additional time to implement recommendations. Now I'll move on to share a toolkit update from the latest analysis of case recommendations from the learning community. So this may be new to some folks, so I'll share a little bit of background. The toolkit came about as a result of the SFY21 mid-year evaluation results, and we began brainstorming ways for continued engagement of ECHO participants and to help participants connect the dots on any reoccurring themes observed in cases to help them better manage complex cases in their own practice. State agency sponsors and partners were also interested in helping professionals who were unable to participate in weekly echoes to other available tools and resources. And in this part of the presentation, I'll use the current title of SoC ECHO. These discussions led to adding a resource toolkit grounded in the themes of recommendations observed and resources shared through the ECHO. As the timeline shows here, the toolkit was launched in January of 2022, and GRC has engaged in multiple rounds of analysis of new recommendations and presented 2 didactic sessions to share this resource since that time. The latest thematic analysis was of recommendations from the first and second quarter of SFY22. No new themes emerged, indicating a saturation of toolkit resources. GRC reviewed other recommendations and resource categories for inclusions, and will be reviewing the toolkit methodology to determine if adjustments need made for the next analysis beginning this month. So here's a little bit more about how to use the toolkit. Again, if some folks have not had the chance to see it. It can be found on the Ohio Wraparound site, link listed here, and I can share in the chat after the when I'm out of my slides. GRC website is where it is housed, and so you can go directly to the GRC website link as well. And so this is the home page here. And I've shared another screenshot here to show you toolkit recommendations and resources are organized into the following themes on the toolkit: evaluation and assessment, therapy intervention, education resources, youth support, family caregiver support, cultural resources, and team support and resources. And once you are in the toolkit, you can use these toolkit topic buttons located at the bottom of each page to navigate through the toolkit and learn more about each section. Here are some things to keep in mind when looking through the recommendations and resources in the toolkit. They may mention a diagnosis such as autism spectrum disorder, but the items could also be applicable to the needs of many youth with similar needs who do not have that diagnosis, and they are not specific to one youth or family. Recommendations typically fall under one of the following categories: services or providers, supports, or education and training. And when we say service, that could be an evaluation or assessment, specific type of provider, evidence-based intervention. Supports could mean peer support, agencies or organizations that help people participate in their community, or any online resources that might assist providers or youth to meet their goals. And the education and training recommendations may be for families or providers or both. And their resource links are primarily links to publicly available online resources and trainings, so should be fairly easy to use. But there are also a few links to book recommendations that may not lead directly to the book, but might help you understand where to access those books. So here I have just a few recent case examples just to show you how toolkit resources could be used in practice. So these are priority questions taken from previous cases with no PHI, but then how that played out after the ECHO session, how that resulted in recommendations. So in this case, the team had a question about how they could best support youth and family regarding disruptive behaviors. So recommendations from the SoC ECHO team included items that can be found in the evaluation and assessment section of the toolkit, such as considering an assessment by an occupational therapy to determine if the youth was experiencing sensory processing difficulties, suggesting that the team consider completing a functional behavioral assessment to look at factors or underlying issues that may be triggering or reinforcing challenging behaviors. And then there were some recommended resources from the section that were given to the team, which were Kelly Mahler's website with information about interoception and the O'Callaghan Lending Library. Here is another example where the team was looking for supports and services that could assist the youth in returning to the community and preventing specific behaviors. And recommendations from the SoC ECHO included items that can be found in the therapy intervention section of the toolkit, such as trauma-informed strength-based approach in therapy to increase the youth's social problem-solving and regulation skills, considering the use of trauma-informed experiential play therapy to increase social problem-solving and regulation skills, and also prioritizing physical activity and exercise as part of the daily routine with the necessary sensory considerations. So then a recommended resource that was also shared related to that was a recorded presentation from Chris Filler from O'Callaghan on sensory considerations and supports for the home. So this list is not exhaustive. This is just an example of how we got from A to B to C to the toolkit. And then this last example, the team was looking for suggestions about matching strategies, treatments, or connections to better support youth and family. Recommendations from the SoC ECHO included items that can be found in the youth support section and the family support sections of the toolkit, such as exploring motivators with the youth and working with the youth to identify their goals and supporting them in connecting with other youth who have similar life experiences. And then they shared recommended resources from this section for connecting with peer support, which were links to Youth Move Ohio and HAM here. So just a little more information in case folks want to check it out. I really thank you for your time today, and we will be in touch soon with more toolkit updates as they're posted, and we hope you have a chance to check it out. Thank you.